What is labor? Labor is the physiological process that occurs in the pregnant women between 37 to 42 weeks that lead to the birth of the baby and the delivery of the placenta and the membrane. So the labor begins with regular painful contraction. These contractions occur at a rate of 1 to 2 contraction per 10 minutes and usually last for 30 to 60 seconds. After the contraction, the cervix will be completely dilated and the baby passes through the cervix and is delivered. After the delivery of the cervix, the placenta is also delivered, which will mark the end of the labor. It normally lasts for 18 hours in nulliparous and 12 hours in multiparous. It is the maximum duration to differentiate between the normal and the abnormal labor. So the further it is labor is divided into stage 1, 2 and 3 and into the sub stages. Stage 1 begins with the regular or painful contraction. Why these regular painful contraction? One of the reason main is fall in the progesterone and the increase in the estrogen around 37 weeks that results in the stimulation of hypothalamus that gives the positive feedback signal to the posterior pituitary gland. The posterior pituitary gland releases the oxytocin. This oxytocin acts on the uterus to cause the contraction, and this is by the mechanism is by opening of the calcium channel. Calcium influx lead to the actin myosin interaction and contraction of the uterus. When the contractions start, the cervix is completely closed, that is it is 0 centimeter, and sometimes there is a plug in the cervix which is stained with the blood, that is called mucus plug. And this state ends with the complete dilatation of the cervix, and the complete dilatation is around 10 centimeter. In between there is a threshold dilation that is 3 to 4 centimeter. When the contraction begins, from the 0 centimeter the cervix begins to dilate to 1, 2 and 3 and 4. When it reaches at 3 to 4 centimeter of dilatation, this dilation acts as a threshold and a further dilation will occur rapidly. So this threshold divides this stage into latent stage and the active stage. Latent stage lasts only for 3 to 8 hours and the active stage lasts for 2 to 6 hours. So overall the changes that occurs during this stage is, number 1 is the effacement. What is effacement? Simply the shortening of the cervix. The second thing that occurs in this is cervix become thin, then it further become soft, and finally it is dilated. So these are the 4 cardinal changes which occurs in the cervix. Cervical changes is actually the first stage of the labor. Since calcium is actually causing the contraction, if we give the calcium blocker, we can delay this stage. During this stage, since when the contraction occurs, the plug of the mucus that is stained with blood is pushed out. So this movement is known as show. What is show? Simply this mucus plug moves out. Also the membrane of the this fetus can rupture and the amniotic fluid leaks out as rapidly, which is referred as gush. So we can have the gush or show along with this the regular painful contraction, which is the diagnostic point. At the end of the contraction, the baby or the fetus starts moving towards the outward through the inlet and the outlet of the pelvis and is delivered ultimately. So this is known as second stage of the labor. In the second stage of labor, it begins with, so hallmark is actually the movements. We are dealing with the movement of the fetus to outside, and it is completed when the baby is delivered. Baby delivery. When the baby is delivered, the stage is over. So after the delivery of the baby, when the baby is outside of the uterus, baby is outside, the placenta is still along with the umbilical cord, the placenta is still attached to the uterus. So in the third stage, it is marked by the delivery of placenta, and it usually lasts for less than 30 minutes. This is the third stage. This is how the labor is taking place. In the second stage of labor, we have to consider a lot of things. One hallmark is the movement. It is further divided into passive and active. The movements are not occurring by itself. They are being, fetus is being moved, forced to move outside. First movement is uterine contraction, which is under the influence of oxytocin. So these movements are occurring passively. Uterine contractions are occurring there, but mother is not pushing until the fetus reaches at this pelvic floor. So push of the mother, active push is absent. That is why it is called as passive movement. Once the fetus head reaches this pelvis floor, these are the levator ani muscle, which are the skeletal muscle. These skeletal muscle develop an urge in the mother. So along with the contraction, mother actively try to push the baby downward. So when there is an active pushing along with the uterine contraction, we call it active stage of the second stage. Uterine contraction along with push is also present. So this whole process takes almost less than 3 hours as a maximum time interval. Now in the second stage of labor, first thing we have to consider is where the baby is. Where the baby is simply means at what station baby is present, at what station. Now how we will describe the station? This is the pelvic bone and this point is the ischial spine. Ischial spine is considered at 0. When the baby is reached at this point, it is at the destination. If it moves downward, it will move toward +1 up to +5. It is moving outward, so we are getting the normal delivery. If the fetus is above this ischial line, so station could be -1 up to -5. The more it is above, the more it means that it is not moving downward, so it is not coming out by itself. So we may go towards the delivery, that is C-section delivery operative, and we can use the finger method to see the engagement and the station of the baby. After the station, the next thing that we have to consider is the lie of the baby, how the baby is lying. If this is the mother, these 4 are the mothers along with their baby in their tummy. So when the baby longitudinal axis is along the longitudinal axis length of the mother, it is known as longitudinal lie. In this mother, the baby is lying transversely, horizontally, so it is a transverse lie, and it is neither transverse nor horizontal. It is at some angle, not at 0, not at 90 degree. So this is known as oblique line. O stands for oblique. So in the lie, we can have the longitudinal, transverse lie and oblique lie. After the lie, we can palpate the abdomen of the baby to check the lie. Then next one is the presentation. What is presentation? The part of the baby which is coming out of the cervix, which are the part that is in downward, is actually representing its presentation. In this part, the baby's head is downward, it is coming out through the cervix, so it is a cephalic presentation. Here the limbs are coming out, so it is a breech presentation. If we have the cephalic, think about the normal delivery. If we have the breech, go for C-section. And when in a transverse or horizontal lie the baby is present, most probably the shoulder or the arms are the presenting part. So a part could be the cephalic, it could be breech, or the shoulder is the presenting part. Now last but not the least, the most important is the movement of the baby, how the baby will actually move through this whole scenario. First movement is known as engagement. First is engagement. What is engagement? When the head of the baby enters the pelvic inlet, this is the inlet of the pelvis, it is known as engagement. After the engagement, the baby will simply under the push of active and passive movement moves towards the levator ani or the pelvic outlet, and it is simply descending in the pelvic cavity, so it is known as descent. This is the mechanism of labor. After the descent, when the baby reaches at the pelvic outlet, which is formed by this floor or levator ani muscle, it has some resistance, and along with the resistance, to decrease the diameter, it will flex the head. So the next movement will be flexion. Now let's bring our baby. Normally the pelvic inlet is transversely widest part. The transverse diameter will be the widest one. If we have the baby, normally it is not lying exactly horizontal straight. It is at some angle, and this is the head of the baby with the face, and the back one is the occiput. When it is moving through the transverse diameter and it is at some angle, so it could stuck there, so it has to go some rotation in order to actually fit, and the position will be transverse. So the baby will go some internal rotation. This is the shoulder part, the widest part. Head is not the widest part. So shoulder become transverse and the baby undergo internal rotation and it moves downward. So the baby is still inside the body and it undergo the internal rotation, and now it is moving. The shoulders are in transverse position. After the internal rotation, below the symphysis pubis, when the occipital anterior position is the most common. When below the symphysis pubis, if this is the symphysis pubis, the baby will move out like this, and when the head is delivered, the occiput will extend and this will undergo the extension. After the extension, the head is still not exactly in epi view, it is at some angle, so it will undergo some rotation for alignment, that is known as restitution. This movement is called as restitution. And the next important movement that occurs, now the shoulder of the baby, which are in transverse position, has reaches the pelvic outlet, whose widest diameter is not the transverse but AP. So pelvic outlet is widest diameter is in this way. When the baby is coming in transverse position, it will stuck there. So when the head is outside externally, it has to rotate again so that the shoulder or the widest part of the body is in AP view and it can easily slip through that part. So it will undergo external rotation. After the external rotation, the baby is delivered and the anterior shoulder is the first part to be delivered. The first one is to the anterior shoulder. So this will complete the whole process.